Let's begin. Good afternoon, everybody. Welcome to today's December 17th meeting of the Portland Children's Levy Allocation Committee. I am City Commissioner and Allocation Chair Dan Saltzman. On my far right is Julie S. Young, the city-appointed citizen member of our committee. Next to her, on my immediate right, is Adrienne Livingston, who is the Multnomah County citizen-appointed member. On my far left is Ron Beltz, representing the Portland Business Alliance. And on my immediate left is Multnomah County Commissioner Deborah Kafori. And now I'd like to introduce the staff of the Portland Children's Levy. There's Program Director Lisa Pellegrino, who's in charge of after-school investments, in addition to being overall Program Director. Assistant Director Meg McElroy, who oversees the early childhood and mentoring investments. Lisa Hansel, who supervises the foster care and child abuse prevention and intervention investments. Communications Director Mary Gay Broderick, and Fiscal Specialist John Kelly. And now, before we get much further along, I wanted to brief everybody on where the renewal of the Children's Levy stands, now that I can safely say that the Council has voted to place the renewal of the Children's Levy on the May 2013 ballot. This will hopefully be a third in 3 victories. As most of you know, the Children's Levy was first approved by voters in 2002 and was overwhelmingly renewed in 2008. And because we are a 5-year local option levy, we must get renewed again in 2013 in order to maintain roughly $10 million a year of annual investments in proven cost-effective programs that at any given time are improving the lives of 14,000 children. And we do that, as most know, by investing in early childhood programs, by investing in after-school and mentoring programs, child abuse prevention and intervention, and helping children in foster care. And we continue, as we will going forward, in the request for voters to renew the levy with keeping a 5% administrative cap so that 95 cents of every dollar goes directly to the proven programs that achieve results for the city's most vulnerable children. And we will also, as I mentioned, and I've spoken to my colleagues on the allocation committee, provide in the renewed levy additional focus on an issue that demands our attention, and that is childhood hunger. We will look to make sure that either through the programs we currently fund or through special focus through requests for proposals to look at ways of dealing with the fact that we have too many hungry children in the city, and when children are hungry, they're not learning, they're not performing. We know that in this year, 2012, sadly, the Oregon Food Bank feeds 14,000 children through its emergency food bank program. One of the things that I've spoken to my colleagues about is we providing additional focus if we look at partnering with organizations such as Meals on Wheels, for instance, to provide supper or dinner for hungry children, either through home deliveries or through the meal sites that Meals on Wheels presently operates. This would be done through a traditional request for proposal process, but I believe this is something that we should take a serious look at, and I've spoken to my colleagues about that, and we'll be talking more about that once we get the levy renewed. So again, the levy will be on the May 2013 ballot. We're asking voters to renew it at the exact same tax rate it is right now, 40 cents per $1,000 of assessed value. The new levy would begin in July 2014 after our current levy expires in June of 2014. So that takes care of our levy renewal. And I look forward over the next few months. We'll be talking with many people throughout the city to encourage their support for this renewed levy. So we'll start our meeting by asking for approval today of our minutes from our August 3rd meeting. Is there anybody has any questions or any changes? Take a motion to approve.
So moved.
Second?
Second.
Okay, it's moved and seconded. All in favor, say aye. Aye. Okay, it's unanimous. Minutes are approved. Now, as we always do at our meetings, we have an opportunity for anybody in the audience who wishes to address us about any general matter with respect to the children's levy. Do we have anybody who wishes to take advantage of that? Okay. Seeing none. And actually, before I did forget to mention one other key aspect I think that is of interest to everybody in this audience. And that is, well, I just mentioned we're seeking renewal of the levy at the existing rate due to things called tax compression and the voter approval of a Multnomah County Library District in the November election. We are looking at losing about $1 million of capacity due to property tax compression. And I'm pleased to say, and that would begin in fiscal year 2014 or July 2014. But I am pleased to say, as a result of discussions that I've had with Multnomah County Commission Chair Jeff Kogan, and I know he's had those discussions with his colleagues on the County Board of Commissioners, they have committed to fund 8 Sun schools that we presently fund through the levy. So while the compression costs us $1 million of capacity, the county's commitment, we thank Commissioner Kafori too, by stepping up and assuming funding for 8 Sun schools that we presently fund, that will relieve us of approximately $750,000 of funding obligations. So that pretty much works out in the wash, and thanks, and as you'll hear, and I don't want to steal John Kelly's thunder, but you'll hear that the remainder of that we're going to be able to make up through our current budget. And actually that does lead us into John Kelly's update on finances.
Thank you. Good afternoon. So I have 2 points to make. One is about the current year, fiscal year 2013 that we're in now. We're about almost halfway through. The good news is we have enough revenue, we have enough money coming in from property taxes to cover our commitments, which are $9.4 million. So that includes $8.9 million in competitive grants, and the balance of that 9.4, about $500,000, is leverage fund grants. So we can pay for what we said we would pay for at this time. Last year, the message was different. We had a 12% lower revenue than expected, so that's not happened this year. The taxes are imposed already, so folks got their bills. We know what we're going to bring in. So that's good news for this year. In fact, the city economists, we got $100,000 to $150,000 more than projected, so that's nice. My second point is about next year, fiscal year 2014. As Commissioner Saltzman said, the most recent revenue projections show us having about $1 million less than we anticipated a year ago when we got revenue projections. However, we do have enough funds, or we expect to have enough funds, to renew all the competitive grants, so that's the $8.9 million, and the remaining leverage fund contracts, about $238,000, should the allocation committee choose to do so. So currently, the only decisions that have been made for next year are the $238,000 in leverage fund grants. There are 4 or 5, I don't remember exactly, that have some funding committed for next year. So we're able to make up the $1 million shortfall in part by transferring $744,000 to the county, and then we have some unspent funds from prior years, so that makes up the balance. We didn't expect to have $1 million sitting around, but it turned out that we did. There was some significant underspending last year, about $425,000. So I just want to close by saying the committee has not yet made funding decisions for 2014, but should you all choose to just straight renew the programs that we're currently funding, we would be able to do that. Any questions?
Questions?
Yes, I have a question, John. When you say that there was about $425,000 unspent last year meaning?
The year that just ended in June, so
So
fiscal
the
year 2012.
fiscal year 2012?
Yes.
Okay, thank you.
Other questions?
All right, thank you.
Okay. So the upshot is the committee, if it so chooses, to renew all of our current investments for 1 additional year, we have the funds to do that.
Hold investments constant. We would be able to.
Keep investment on. Great. So next up, we have Lisa and Meg, and they're going to present an update on state and local initiatives that share common goals with the goals of the Portland Children's Levy.
First, use this one or you use that one? Okay. So we wanted to bring you up to date a little bit on some of the other work that's going on in the community. I know that you have varying levels of participation and knowledge about those different efforts. More just to remind you of the context that we're working in and to let you know if the levy is successfully renewed in May and then we are going out for proposals again, that these are things that would color and influence potentially the kinds of investments we might want to make. So that's it's sort of a little bit of a prep and make sure that you guys kind of follow along with what's happening. So Meg's going to talk first about some state efforts that are going on around early childhood, and then also about some local efforts with the Cradle to Career. And I'll finish up with the after-school side.
Great. So as you know, the governor recently released his budget, and in there is a proposal to invest about $10 million from the former State Commission on Children, Families, and Community System into what the governor and his Early Learning Council have called the Early Childhood Coordinators of Early Learning Services, affectionately known as the Accountability Hubs. And there was a work group formed to look at this task beginning this summer. I've been a member of that work group. And essentially it was asked to think about how to consider a definition, a finance model, and characteristics of entities that would regionally be charged with around the state, holding accountable the funds that we spend as a state in early childhood for kindergarten readiness outcomes as measured by the state's new kindergarten readiness assessment. There are still many details being discussed by the work group about what that regional structure would look like and how it would function. And the work group's final meeting is in a few days on December 19th. And from there, the Early Learning Council staff will be taking that proposal to the legislature and turning it into whatever sort of report and bill they're going to introduce to the legislature to get that regional structure up and running. The primary reason we're bringing it to your attention today is that several of our grantees receive state funding through the relief nurseries, through Healthy Start, through the Oregon Pre-Kindergarten Program, as well as providing childcare and being regulated by state childcare, state law childcare licensing division. So all of our grantees who receive funds through those various funding streams would be affected by this new regional structure and whatever accountability mechanism it puts into place to hold funding accountable for kindergarten readiness outcomes. So we are keeping track of sort of the evolution of this. As I said, I'm a member of the work group and sort of trying to help think through what this structure might look like, and we'll be bringing this back to you to let you know how we anticipate it will likely affect our grantees. Any questions on that?
So what happens at this final meeting?
The final meeting of the work group on the 19th is to finalize its overall recommendations on what the regional accountability hub structure would look like, what its primary functions would be, what the characteristics of an organization or consortium entity would look like that would be charged with doing this accountability work, and then also some preliminary recommendations about what an RFP ought to include in thinking about how to solicit applications for entities that would propose to become a hub.
And how many regions is the state divided into?
The state isn't defining the regional structure. It has asked that the work group consider not having that defined and instead sort of operate under the assumption that regional geographies would self-define what their regional structure would be and that would be part of the application that they would put forth. So the work group hasn't done any work around defining the regions.
So is it likely that in, say, the Portland-Multnomah County region, I mean, that, would it be more than one county, or we don't know, or?
I think that's unclear and would be left to folks to decide regionally. I I will say that the work group has been provided a lot of information about how the healthcare transformation and community care organization RFP came, its entire process from sort of how to think about those regional structures to the actual, what they call request for applications process, and sort of what results it yielded. And so in Multnomah County, there are 2 coordinated care organizations, one that covers Multnomah, Washington, and Clackamas counties, and is, I would say, very comprehensive. It includes the major providers of healthcare services in our region, and then one very small entity that's just specific to Multnomah County. So the work group has not necessarily defined not only what the regional structure would look like, but it also hasn't limited that regions couldn't overlap in the same way that the healthcare transformation and CCO structure hasn't limited the ability to overlap, because there may be compelling reasons why that would why you'd want that.
The other thing to keep in mind potentially, and we'll see how it all fleshes out, obviously, as to whether this would work, but to the extent that there's any kind of reporting efficiencies or alignment that could happen with us and them, since they will potentially be coming into existence before we're kind of up for refunding programs if we are approved by the voters again. So that's something else that we'll be kind of watching for in that piece, and to try to see, we're always looking to limit burden if we can. So we'll see what they end up doing.
And would this channel both state and federal early childhood learning dollars?
That's a great question. These are all great questions. The state would like to think that that could be the potential, that the hub would have that potential in the long run, but in order to get to the ability to have a regional structure that holds federal funding accountable for those outcomes, there would need to be other waivers from the feds around other things that they expect to be done at the state level in order to sort of pass those funds through to those regional hubs. So at this point, it's only being conceived as a structure that would primarily deal with state funding, but is being looked at as something that hopefully is designed in a way that it can scale out to include federal funding as well, and philanthropic funding and other local funding as well.
Other questions? Okay, thanks, Meg.
Sure. So the next update that I'm going to provide is sort of so bringing it from the state down to the sort of already more local level. As you all may be aware of the Cradle to Career work that's been done here for the past couple of years and is being led primarily by All Hands Raise, which is the former Portland Schools Foundation, but is now it has its reach beyond just the Portland Public Schools District and is including the major school districts in our area, so Park Rose, Centennial, Portland Public, David Douglas, and Gresham Barlow. And the Cradle to Career movement is sort of taking this collective impact approach to how do we, doing similar work in a similar area or focus, such as work with children and families, use similar data and think about our approach in a more intentional and streamlined and aligned way to get to certain types of improvements that we want to see in our community. And locally, that's looking at how do we do better at getting children ready for kindergarten? How do we support children better when they're in school? How do we support them better in their out-of-school time? How do we get them to on-time graduation? And how do we make them successful for college or other career interests and endeavors after they graduate from high school? So the All Hands Raised is sort of serving as the backbone organization, they call, to this Cradle to Career effort. And there are, along the Cradle to Career continuum, smaller collaborations looking at some of these points in time of improvement and using the collective impact lens to think about their work. And so the one I'm going to talk to you about first, and Lisa will fill you in on one of the others, is the Kindergarten Readiness, Ready for Kindergarten Collaborative. So what it's seeking to do is think about how to better prepare children for kindergarten in Multnomah County within those school districts. But specifically, the collaborative began to meet in the spring, and it has represented, I wish that Mark Holloway from SVP was here and I could channel him well, but so that there's 2 convening organizations for that collaborative. It's Social Venture Partners of Portland and the Multnomah County Commission on Children, Families, and Community. And I think Mark would tell you that there have been over 300 people who have at different times participated in the monthly collaborative discussions from, I want to say, around 100 organizations. So it has had a really broad representation, and I would say at the meetings I've attended, there are at least regularly 60 to 70 people there. So if you can imagine sort of always facilitating a group of that magnitude to have a discussion about how we ought to better support kindergarten readiness in our community, it can be sometimes a little bit of a bulky process. In any case, the convening groups and the facilitators have helped the collaborative move along to sort of narrowing the scope and thinking around what the collaborative would want to do. And its primary focus is not only on kindergarten readiness, but specifically supporting the kindergarten readiness of children who are most likely to arrive at school, least prepared for kindergarten. So that's children of color, children who are from families where the primary language in the home is something other than English, and children in poverty. And then there's now sort of, the collaborative is at 2 stages right now of sort of trying to further narrow that focus, because in an effort to sort of really hone in on what it's going to be able to affect using this collective impact lens, it needs to think about which schools or neighborhoods would it really want to sort of bring people together to look at this issue and really try to make measurable change for children in those populations. And so it's in the course right now of using school level data to look at how it might propose to the collaborative options for narrowing the schools where the collaborative would focus its efforts. And then it's also starting to look at the 2 strategies that the collaborative has sort of begun to identify as what they believe to hold kind of the most promise for making measurable change. And the first one is more intentional focus around that the year called kindergarten transition, the year before a child transitions into kindergarten. So thinking about all of the opportunities that we might be able to better coordinate and make available in a given locality, school catchment area for children who are going to enter kindergarten in that fall, including getting them registered on time, getting them information about different kindergarten preparation opportunities that take place throughout the year. So a better sort of outreach and communication channel for those families and children prior to kindergarten. And then the other strategy that they're looking at is how to better reach families with children ages birth to before that kindergarten transition point, birth to 4 basically. And thinking about how to better coordinate in a given locality all of the folks who are working on parent-child type service provision, and how to support them in being able to do their work a little bit more strategically to help prepare kids for kindergarten, including what are some of the other audiences that they work with, childcare providers who are not like family, friend, and neighbor providers, we call them, so a relative or a friend who's taking care of children who isn't necessarily a licensed child care provider, but bringing them sort of online with the idea of kindergarten readiness, as well as reaching faith leaders in a given community and kind of thinking about what are the messages or the important things we want to kind of try to have a community in a given region understand about preparing young children for kindergarten. Any questions on that one?
Okay, so I will update you. There are a total, I think, of 4 active collaboratives right now that are operating in the Cradle to Career kind of network. One of them is called Ninth Grade Counts, and they are specifically working on summer, and they've been sort of in existence the longest, and they predated the kind of naming of the Cradle to Career initiative. And they work on summer opportunities and transitions for kids. So they are sort of off and running, and none of us is actively, many of our grantees participate in that as providers to help coordinate that system, but none of our staff are specifically sitting on that group. The other is working on, it's called the Community Supporting Youth Collaborative, and I'll go into a little bit more detail about kind of what they've ended up choosing to focus on. And then there's another collaborative that is specifically focused on trying to reduce disparities in the way that policies within the school systems are carried out. So things like differential discipline, other types of things. To be honest, that collaborative is kind of a closed collaborative. You need to be invited to participate. So we haven't been actively participating, but we're just following it from the outside. So they're continuing to meet, but they are specifically working with school districts around policy changes. And so that they've got all the districts representatives sitting there. So when they kind of head down more to the strategy level, we'll bring you kind of what that is, or they're just still working on that at the moment. Most of the the collaboratives are kind of forming their strategies and beginning their action plans right now is kind of the stage that people are at. So when they get a little bit further down that curve, we'll let you know what that is. For the Community Supporting Youth Collaborative, which is the collaborative that I've been sort of participating in and working at more the ground level. That group has chosen, again, through the sort of the process that Meg outlined, to try to focus on attendance, on school attendance, and to think about that kind of from two sides, to be able to look at, there's a lot of work that's come out around chronic absenteeism, and so it's looking at, it's not just looking at overall attendance rate, so yes, how many kids, meet the 90% level that we want everybody to meet, but specifically for the ones who, being able to identify in real time who is chronically absent, and catching it before it gets to a level where you look at the end of the year and say, they only came 80% of the time. So the idea is to find a systematized way to look at that. And so that involves data gathering and being able to turn data around into the hands of people who can use it in real time, which sounds like it should be easy, but is actually not often easy. So that collaborative wants to work on what kind of policy level changes and district level changes would need to happen in order for that sort of information to be actionable. And then also to be able to involve the community in creating actions to deal with those situations. So the schools can do some things, but what also can community providers, and how can people sort of coordinate to do a better job of that? So that's one arm of the strategy. And then also folks are looking at how can we look at engagement as one of the issues. There's many issues in absenteeism, but engagement is one of them, particularly as kids get older. So how do we improve engagement? And of course, many of the grantees that we fund look at that very issue, and we fund activities to provide engagement. So that's why we're kind of involved in this one, because this affects a lot of the people that we fund, and a lot of the people that we fund are participating in this. So folks they're heading into sort of the action planning stage, although they're still refining the strategies to sort of name in a more specific manner, what do we want to try to do in effect, and what sort of outcome do we want to see from it? So these strategies are very much aligned with the work that we're funding out there in the community. So that's good news, and then we'll kind of see what develops as people begin to put pen to paper, and with a little bit more concreteness, if that's a word, about what they're going to pursue to make that happen. So I think it's overall good news in terms of accentuating the work that we're doing, and then we can look at that in context. They will have been sort of up and going starting next school year, and that'll be prior to when we would be looking at further investments if we pass. So it'll be good timing, I think, to come back and look at this again. So any other questions about what's going on with Cradle to Career? Since I know some of you, I know Adrian's now sitting on the steering committee, so I know different people are involved in different ways.
Can you say a little bit more about the timeline for when you might see? I think I heard you say, Lisa, that in terms of school engagement, that may be something that we would see certain things in place by the next school year, that the districts would be ready to adopt and actually implement this. Is that correct?
Yeah, I mean, that's the idea. And I don't want to phrase it as if the districts would adopt. I mean, I think this is not just driven by what the districts would do. It's driven by what service providers and various other people, school personnel, who are operating in a particular geography. And again, they haven't really set forth which geographies do they want to focus on, because I think it's unlikely they could do everything all at once. But how do you coordinate and align better around engagement and attendance? So people might be working on this in a disparate manner in a given geography, but can we bring people together to work better on it as a group is part of the concept. So it's not just what districts can do, but also what local providers and personnel can do. So that part is not really been sketched out fully in terms of, the idea would be for next school year, as far as I understand, yes, okay, in terms of timeline. But between now and then, there's a lot that needs to happen to make that implementable by then.
Okay. And in terms of the early childhood,
that's a great question. I mean, I know that the kindergarten registration and kindergarten transition sort of strategy work, they want to get started pretty much in January and February. But the community-based strategy discussion and the data discussion is still evolving, and so I'm not sure what the timeline is for that. It seemed like at our last meeting, which was last week, we got sort of behind on what the sort of agenda and timeline were for finalizing the strategies and starting to really look at the data and what they tell us about which schools might be selected. So I think that's still probably yet to be determined in the next few months. So I think it's going to be a little bit behind what they were anticipating.
Thanks.
Yep.
I have a question, Meg. Can you tell me, since the Commission on Children and Families is in limbo or no longer
sunsetting,
yes, how that's working with this kindergarten readiness collaborative?
That's a good question, and I don't know that they really have figured out the answer to that, because I think they're kind of waiting to see. When I say they, I think SVP and the commission, as the commissioners, as well as the staff person or staff people who are at the commission, are sort of waiting to see what the final hub product is that's adopted by the legislature, and then kind of waiting to see whether it's Multnomah County or some other entity or entities that decide to apply for that, and how the former staff or structure or anything about the commission would be maintained. And so I think that there's sort of these questions about, we don't know, and so we'll just keep working as well as we can until we have better answers.
So you can see how these efforts are kind of all hooked together. So that's the other piece of why we wanted to make sure you're kind of on the same page with it, because things are kind of operating in interlocking pieces. So outcomes in one place affect outcomes. So when we make funding decisions, it affects and ripples throughout these other systems too. And it's not always so clear. So we try to do a better job of keeping on top of that.
I think even if you keep a really good job of being on top of it, it's still not going to be clear.
Well, that's a good point. Yes, as clear as mud, maybe, but as at least trying to stay abreast, shall we say, of the developments.
Like trying to understand compression.
Yeah.
Yes, exactly.
Great
It's always
analogy.
evolving.
Not too hard.
Yes,
Causes your head to ache.
makes your head hurt.
Well, I appreciate the time that you all spend on this, because I know that it can be confusing and daunting, but it is important because, as you've said, they're all interrelated. So, thanks.
Okay, well, I guess, are we ready to move on to
think
data
we are.
presentation?
Yeah. You're going to drive it for me? Thank you. You're so nice.
So I'll just, by way of queuing it up, one of the things that we take great pride here at the Children's Levy is our data, being able to demonstrate that the programs we invest in are in fact proven effective programs. And secondly, that we watch and we make sure that investments are being invested in directly in the services that are helping Portland's kids. So this is in line with that. I think this is part one of our annual data presentation.
Exactly. So I know Julie is the only person really who's new here, so you guys have all heard this before, and we will attempt to not have you all glaze over, because I know everybody doesn't love data as much as we do. But it is really important to look at this on an annual basis, because it helps us understand. We do have certain policy goals, and we want to make sure that you all are keeping track of those policy goals and seeing what the data says about whether we're reaching them or not. We also want to highlight your grantees. Provide us with a lot of information to keep them accountable, and that is a piece of what we promise in this levy, is that we will hold people accountable. So we want to make sure we highlight the good work that they do, and also the effort it takes to provide that accountability isn't free and for anybody. So it's a major effort to do that on everybody's part. And then last, we provide this information so we can make improvements over time. And I think, we're always kind of tinkering to try to figure out how can we ask for less information that's more meaningful, always is kind of the bottom line. So that's where we're headed today. As Dan mentioned, this is the first part one of this presentation. And this presentation will focus on sort of the demographics of service, as well as sort of overall levy policy goals and whether we're meeting those. The second part of the presentation, which will probably happen in February, will focus on program participation levels, which is a very key piece of whether you're getting outcomes, and then also the outcomes of the services for the year, and then staff turnover, which we always look at as kind of a best practice for programs trying to keep a staff for at least a year. So those are the report topics. We're only hitting part one today. And just to be clear, all data in this presentation is from the last fiscal year, which is the 11-12 year. So it's not including this current year. So the other thing to keep in mind, you're all aware of, we had to go through a fairly severe cut process last year. This is all essentially things that happened before any cuts were made, really. Only that 4.5 across the board cut that was made during the last fiscal year operated in this time. Does that make sense?
I'm getting a little confused on my last fiscal years. When you say last fiscal year, you mean
that was the 11-12.
July 1st, 2011 to June 30th, 2012.
Exactly.
Okay.
So just because I know the people, it's hard to keep the fiscal year straight, so I'm just trying to make sure that people understand this is in this little view we're giving you, the major cuts have not taken place. So just to keep that in mind, there'll be probably significant change in many of these things next year, but we're not going to see so much of that this year, if that makes sense. So first, I'll let you know just kind of what we're going to look at and why we're going to look at it, because I feel like sometimes people are like, why do we have to talk about this? So The information we're going to talk about is related to a lot of the risk factors that folks experience that make them more likely to have negative outcomes, like not graduating from high school or not performing well in school in general before they get to that point. And so we're looking at a lot of the risk factors. That's what's driving a lot of the data elements that we're going to present to you here today. So for instance, age. We look at age in part because we want to make sure that we are reaching kids early and that we are front-loading our investments in early childhood, which pretty much every piece of research in the last 10 years will tell you is a wise move. So that's one of the things we want to look at. We want to look at socioeconomic status because we know poverty is a predictor for poor outcomes. So we want to make sure that we're reaching that portion of the population that has that risk factor. We want to look at primary language in the home because, as Meg mentioned, was in the early childhood sphere, that is an early and significant risk factor for many poor academic outcomes as well as other outcomes. And then last, race and ethnicity. We want to make sure we look at what the portion of populations from different racial and ethnic groups that we're serving to make sure that we're covering that population that has higher risk factors. So those are the reasons why we look at those variables, because we're going to give you some information about them, but I think it's important to understand why we bother to look at that information. And the staff is looking at that information on an ongoing basis to assess whether we're doing a good job at reaching those populations with our investments. So that's kind of where we're heading. I'm going to hit first just looking at our overall number of children served. And again, this is something that we look at on an annual basis because we're looking at it with each grantee to understand are grantees hitting the targets of kids that they think they're going to serve. So when people come to us and propose to deliver a program, they tell us how many people they think they can serve with our funding. And so we are negotiating on that point with them usually and then monitoring to make sure that they are actually serving that number of people. So you can see on this slide, the goal was a little over 14,000 and the actuals was a little over, or I guess substantially over 14, almost 15,000 and the actuals were almost 18,000. So we are substantially in excess of our goal, our grantees are, by serving more than 20% more than what they anticipated serving. We look underneath those numbers to understand why, because it isn't always good news if somebody is serving more people. It could be because people are milling through a program and not actually staying the full time. So that's not an outcome that we want. We want people to stay and get the full benefit of the service. So we do look at, that's why we look at participation levels, which we're not going to be examining in this part of the presentation, but we'll talk about later. But in looking underneath what drove that increase in the number of kids served, we can see pretty much that it's due to large numbers of children that were served in a few programs that offer drop-in services and less intensive service models. And in those kinds of models, it's your goal is often to serve as many kids as possible. You want as many people to make use of your drop-in services as possible, but it's also difficult to predict how many people will. So in any given year, you may have fluctuations that are driven by various factors that you don't control. So we're usually, when we're negotiating, what do you think the minimum, at the very, you want to make sure you're going to serve at least this many. And so in some cases, people were substantially in excess of that.
So Lisa, the goal is set out by, that's the aggregate of each individual grantee and the goals that they set out for
Yes.
them, not necessarily, okay.
That number represents the whole. So you can see this year we were significantly overshot. And when we looked back at the programs that overshot, it was pretty much the ones that were as we described, less intensive models, drop-in services.
And do you work with them during any point of the year to let them know that maybe they should, or talk with them about potentially scheduling fewer or trying to cut back on that so that they're not reaching out to so many?
Well, it depends on the nature of the service.
I mean,
in some situations that's not appropriate. You want as many people to come in and make use of that as possible. What we do is we watch trends for each grantee. We watch what the trend of service is over time, because if we end up renewing funding to that grantee, then and sometimes we change service targets during the course of the grant. If 2 years go by and they've served double what they predicted, then I insist that they raise their goal. So it's an ongoing conversation. So we're looking to see what is actually happening. Also, conversely, people will come to us and say, I'm positive with a new program. I'm positive I can serve as many people. Well, then 2 or 2.5 years go by and they're nowhere near that goal, and we're like, okay, you're not gonna make that. That was clearly unrealistic. So new programs are always the hardest because they're charting new territory and they're often trying to serve a population maybe they never served before, and you want people to do that, especially if it's a population in need, but often you don't have quite the same markers. So we're always in that, watching those numbers and trying to negotiate. But like I said, with drop-in services and less intensive models where people are coming for shorter periods of time, even Sun Schools, okay, Sun Schools we use the counties. In this case, we didn't invent the wheel. Sun Schools, we use your guys' overall projections on what you mandate people serve for the money that's given. And often people serve double what that mandate is. So I haven't tinkered with those obligations because we're trying to stay aligned with the county on what the obligation is, but that's often because there are many services that you can participate in a Sun School that are short-term. You might come to a class that is a 5-week class, and that's your participation. So you might get a lot of kids coming in for relatively short times, and then you get a core of regular attenders. So you want kids to come in and participate in that class if they're interested. You want to engage them in something that's not a bad thing, but it's difficult to predict sometimes how many kids are going to do that. So the county is also coming up on their own. They'll be looking at their program instructions again, and they may choose to up them if they look at their whole pool of programs that are being provided and can see that really most people are able to serve more than whatever the current minimum is. So is there something else you want to say? No. So that's some of the examples of what drives that increase at times, and it's difficult to predict it. That's the main issue. So anyway, bottom line is it was not any significant real concern on the part of staff that this was representing a lot of milling of people, coming through and for only a short time when that wasn't appropriate. Okay, so the next slide the other thing we keep track of on an annual basis is try to understand what the overages are in each program area, just to see if there's anything that's particularly accounting for an overage or if there's any particular concerns in any given program area. So the biggest areas where there was kind of excess or exceeding of the goals this year was in after school and in child abuse. And after school, I've kind of run through some of the reasons for why that was higher. We saw some programs serving substantially more kids this year. That was definitely one of the most significant reasons for driving that number. The other biggest thing that drove the increase is that many people, it's all about how you conceive of funding. So we may fund a program, but we actually only provide 35% of the funding for that program. But what a grantee will do is mix all of the funding sources for a program, and they will report to us on the entire program, not just on the 35% of the kids that we're serving, because it makes a lot more sense for many reasons to do that. So what happens sometimes if they get an increase in funding from another partner, another grant for that program, they're able to serve more kids than what they originally anticipated. Or this particularly happens in Sun Schools, they get partnerships. They find other people to partner with to offer, say, another 2 weeks of summer school that they didn't anticipate being able to offer when they signed our contract. And that's all good. We want that to happen. But it does create this inflation sometimes in the numbers on an annual basis. And then maybe next year they can't make that partnership so they can't guarantee. We try to set a minimum level of expectation, but it isn't the case that the same partnerships exist every year, and sometimes the same grant funding will, grant funds run out or change, and they're not able to replace. So there is a certain fluctuation there that this year was higher than usual, and I think that was really driven primarily by Sun programs. In child abuse prevention, there's one program that sort of was was that a startup program, the one that is all that?
It was startup
Why don't you talk about it, because you're the first person. I think you probably do a better job explaining to me.
So the child abuse, there's one program that serves large numbers, several hundred people, and it started operation at the end of September 2010, end of September. So this past year was the first year of full operation, and they overserved by a large margin, several hundred. So if we take those numbers out of the equation, then the actual overservice is 12.9%. And also needed to do a little bit of adjustment because in child abuse prevention, the goals are set in some cases around number of families to be served, and in other cases, number of children to be served. So when we compare apples to apples and take out the one program that serves several hundred more than the target, the actual overage is 12.9%. So again, not really a concern there with milling.
Exactly. That's the bottom line. Is we overall, even though we were happy to see that many more kids were served in sun schools and in certain drop-in programs, there was not significant concerns around participation. So that was basically all good news. Is the bottom line. Okay, so next I'm going to move on to talk a couple. We had a couple different, and again, this is partly because Julie wasn't here in the days when we made the initial decisions, and actually maybe even no, yeah, I guess everybody else. No, wait, yes, I guess everybody else was at that point. So when we made the initial investments, we had an application process like most governments, and in those applications, we highlighted that we were seeking to accomplish a couple of overarching things. One of which was to improve the amount of service that was offered in East Portland because we had seen poverty shifting to East Portland, and second was to increase the amount of investment in culturally specific programs as compared to what we had invested in the first levy. And this was in response to a lot of community feedback to that effect, that folks wanted to see increased investment in culturally specific programs to try to serve populations that we know are at higher risk. So those were kind of the two overarching policy goals that we had. And so we are tracking every year to understand, okay, our investments, what are they doing with regard to those goals, and how they performed over time? So the first, around targeting service to East Portland, we took a look at the East Portland Action Plan and their sort of designation of what East Portland constitutes, and they, using the 2010 census data, came up with a figure of about 25% of the folks in Portland live in East Portland as they define it, which is more or less east of 82nd Avenue while still in the city. There's the line moves a little bit in different places, so it's a little bit further east than that, the further north you go, and a little further west, the further south you go, if that makes sense. I didn't actually put the map slide there because it's so tiny you can't really see it, but if you did want to see a map, I could get you one. So we are serving and analyzing over the last 3 years, generally speaking, between 37% and 39% of the kids that we're serving reside or go to school in East Portland. So we are reaching a significant, of the total population that we're serving, is of a significant portion of that population, and in excess of the percent that lives in that quarter is receiving our services, which is good news because the poverty rate in East Portland is about a little over 19%. That's the folks who are at the federal poverty level, which is $22,000 for a family of four, just for reference. And it's only 16% in Portland as a whole. So the poverty rate is greater right there. That's a significant risk factor. We want to be reaching further into that population. So that's, again, good news. Second, with regard to culturally specific programming, again, we watch it over time to understand, is it shifting? And it really shouldn't shift much because we haven't shifted our investment significantly in the last 3 years. You can see that it increased somewhat between the first and the second 2 years, and that was primarily due to your leverage fund investments. When you made leverage fund investments, you invested significantly in culturally specific programs, so that increased that level. And then it's held pretty steady in terms of the number of kids, the portion of the kids served in programming. So that's good news. We would want that to hold steady because we haven't significantly changed our investments. We wouldn't want culturally specific programs to suddenly be serving less or fewer children. The percentage of investment is the same because that hasn't, again, not shifted significantly over the 3 years. So overall, good news, no red flags. And again, this is a baseline from which we can use if we want to increase our investments in the future in culturally specific programming. We'll have this as a baseline to understand this is how much we're doing currently. Any questions kind of on that portion before I hand it over to Meg to handle some of the other stuff? All clear? Okay.
All right, so we're shifting our discussion from the levy-wide policy priorities that were in the RFI and sort of general numbers served to those 4 demographic characteristics that Lisa talked about in sort of the outline of the slide. So we're going to talk about age, poverty, primary language in the home, and race ethnicity, because those 4 demographic characteristics are immensely powerful predictors of children's outcomes beginning from birth and on. So in this first slide, looking at age, again, the reason we are interested in knowing the ages of the children we serve is because we want to know if our investments are sort of focused upstream and toward prevention of the kinds of things we hope to avert later on down the line. As you can see by looking at this slide, around 40% of the children that we serve are in the 0 to 5 age range. And if you take it all the way up to 8 years old, 55% of the children we served are between prenatal to age 8. So we know that our investments across early childhood, child abuse, all of our program areas, after school, mentoring, foster care, are the majority of children served across our investments are in those younger age ranges. One of the other things that we...
Excuse me, what was the percentage total for under 8, 0 to 8?
0 to 8 is 55%.
55%.
And 0 to 5 is 40%. For the past 3 years, if we look a little bit deeper into some program area specific trends, in foster care, for the past 3 years, the portion of children ages 0 to 5 that we have served in foster care has been a lower proportion than the portion of children 0 to 5 who are in foster care in Multnomah County. You see what I'm saying? So we want to make sure that at a minimum we are proportionally keeping pace with what's happening in a certain system or in our overall community. So if 35% of the children in foster care are ages 0 to 5, we would hope that 35% of the children we serve in our foster care investments are 0 to 5. In the past, in the past 3 years, those levels have been unequal. There's a larger proportion of children ages 0 to 5 in foster care than we have been reaching with our foster care investments. This is the first year where we're just about on par with that. So if we want to consider sort of reaching young children more in foster care, we may want to consider in future investments, foster care investments, thinking about policies that would focus more of our investments toward that younger age spectrum if we wanted to not only assure that we were reaching proportionally the same proportion of children who are in foster care and who are young children in Multnomah County, but if we wanted to even sort of overreach that, higher proportion of our children served were in that age range so that we were better addressing that population. If we look at child abuse prevention and intervention, one of the interesting trends is that for the past 3 years, the proportion of children served by the Levy in child abuse prevention intervention is about 42 to 48% are children ages 0 to 5. And so again, in foster care in Multnomah County, about 35% of children in foster care are ages 0 to 5. So our child care investments are sort of reaching proportionally more children ages 0 to 5 than there are proportionally in foster care in the county. So that's a good thing, and we would hope to maintain that kind of level of reach and investment. I'm going to be doing a lot of proportional discussion, and I can tell it's confusing, and I'm going to try to make it as easy as I can, but feel free to interject, yeah.
Just a comment, and that is that I certainly don't have the numbers in front of me, but I believe that the numbers of children where there are substantiated reports of abuse, 0 to 5 is still much larger than actually the number who end up in foster care. Correct. So it might be interesting to look at that data. That makes sense.
Yes.
And that is correct, and it's historically been younger children. There are more reports for younger children, and also, unfortunately, the state data book is not, we don't have a current one out, but I wouldn't imagine that those trends have changed over the last year.
Thank you.
Okay, so the next demographic characteristic I'm going to talk about is poverty. And as you can see in this slide, of the 17,000 children, almost 18,000 who were served by the Levy last year, we reached well over the majority are children who we believe are low income living in poverty. And our definition, we kind of stretch from the federal poverty level all the way up to 185% of the federal poverty level, because that spectrum includes children who qualify for free and reduced lunch program in our public schools. So the red, orange, and yellow portions of the pie show you children who are in families whose income is between that 0 to 185%. The 45% not given, that portion is consistent year to year. It's based on the way in which we collect our data. For the way that we collect these data from grantees, early childhood and child abuse and foster care grantees typically give us that data directly that they collect from the families. But in programs where income is not an eligibility criteria, they're not necessarily required to supply that information. So there's a certain amount of income and socioeconomic status data that we don't get from grantees because they aren't required for eligibility reasons to ask that of the families that they serve. In addition, for our after-school and mentoring grantees, those data we get directly from the school district on the portion of children who participated in our after-school and mentoring programs a certain amount. And so there are a number of children for whom we don't get their socioeconomic status data because they didn't meet those participation thresholds for the data to come to us from the school district. So the total sort of data that we don't get on children and families around socioeconomic status data is about 45%. But I can tell you that, for example, for the after-school and mentoring programs, 80% of the schools that are served by our after-school and mentoring investments have a free and reduced lunch enrollment rate of 60% or higher. So 60% of the students in those schools and 80% of the schools that we serve are free and reduced lunch qualifying. So we know that even though we're not gathering the data in that not given category, we have a pretty good sense that our investments are still reaching large portions of children who are considered low income. Questions on that slide? All right, the next demographic characteristic I want to talk about is primary language. So for the children, the nearly 18,000 children that were served by the Levy, about 22% speak Spanish. I should say their families speak Spanish as a primary language in the home. And then another 10% come from families where another language other than English and Spanish are spoken in the home. So about 32% of the children that we served are from families where the primary language in the home is a language other than English. For the 10% who speak a language other than English or Spanish, that's about 1,800 children, and there are 58 other languages that grantees report to us are spoken by that 1,800. So it's quite a diversity of languages. Over the past 6 years, the portion of children that speak a language other than English or Spanish has increased from 7% to 11% of the children that we serve speaking a language other than English or Spanish. Any questions on that slide? Okay. So the next demographic characteristic I'm going to talk about is race and ethnicity, and we're going to look at this because this is sort of our way of approaching the equity lens discussion. There is a lot of focus in this community around equity, and there is a lot of work being done to make sure that people are using a common definition when they talk about that. So sort of our approach to this right now is looking at equity sort of through a twofold approach. The first is as a portion of the population or a portion of the school district enrollment, are we serving proportionally the same configuration of children as what we see in our school district or in our county? So are the proportions of children of color that we're serving at least, at minimum, the same proportion of children of color as you would find in the school district, as you would find in our community? That's sort of the minimum we would want. The next sort of most important thing is, are we serving a greater proportion of children of color? Because we would want to be sure that we're reaching children who are more at risk of the types of outcomes that we are concerned about sort of mitigating: the achievement gap, disproportional exclusionary discipline, and overrepresentation in the child welfare system. So we're going to look at race and ethnicity because we want to make sure that we are proportionally reaching a more significant proportion of those children in an attempt to kind of understand how well we're dealing with that disproportional experience around negative outcomes. So the first slide just sort of gives you a general breakdown across the nearly 18,000 children served by the Levy, kind of what the portion of children served are in different race and ethnicity categories. So there are those who might like a pie chart and those who might like graphs, so we're going to talk about that in a minute. But in this pie chart, you'll see that the greatest, among children of color, the greatest portion of children that we serve are Latino Hispanic at around 26%, and the second highest is African American and African children at around 18.5%. But altogether, children of color make up around 65% of the children served by the levy, and that trend has been true over the past 3 years. So what this graph is showing you is the very top line is the portion of children of color served by the levy over the past 3 years, and then the lines below break down the subgroups by race and ethnicity of portions of children we've served. So between FY 09-10 and this current fiscal year, this fiscal year we're talking about, this just ended, FY 11-12, you'll see that the rates have remained fairly steady. The sort of small uptick between FY 09 and FY 10-11 is the change in having done some leverage fund investments. So there were some culturally specific leverage and fund investments that helped sort of increase the portion of children of color served and in specific race and ethnic groups. And then there was sort of a little bit of a downtick this past year, and that's sort of, we think, just based on the fluctuation we talked about earlier, where drop-in services and things that are low service models might attract, large numbers of children, but they're not necessarily controlling for kind of the fluctuations in demographics. So we might expect to see sort of the trend over time, if you're not making any significant investment changes, sort of ebb and flow, just depending on who shows up at the door at sort of those programs that serve large numbers of children. Does that make sense? All right. And I'm going to go through a couple more slides and then turn it over to Lisa Hansel to get into some more program area specifics. So on this slide, what we're trying to show you again is that the portion of children of color served in the county by the levy has been around 65%, like I said in the previous slide. And so this past year it was 63%. And what we want to do is make sure, like I said earlier, understand is that at least at a minimum proportionally the same as what the school district enrollments look like and what the county population looks like. And yes, at a minimum it is, and in fact, it's exceeding those rates, those proportions for both school district enrollment and Multnomah County sort of general population. So what this tells us is that the levy is reaching, at least proportionally, the children it ought to reach based on who's in our population, but more importantly, it's reaching children who are more likely to experience lower rates of meeting or exceeding academic benchmarks, disproportionately higher rates of exclusionary discipline in schools, and overrepresentation in our child welfare system. Just to really quick, the school district data here is based on David Douglas School District, Park Rose, Centennial, Gresham Barlow, and Portland Public, excuse me.
Not Gresham Barlow.
Oh, sorry, Portland Public.
Portland Public and Reynolds.
Sorry.
It's the 5 districts that have at least some schools in the city.
Yeah.
And Meg, do you have a slide or any information on the number of children that are in poverty in those to compare?
Poverty who are children of color?
Or both. It would be interesting to have a breakout with children of color and
in poverty
in
and
the
white children?
Portland school districts.
Oh gosh, I don't have that on hand, but I suspect it may. The Coalition of Communities of Colors report that came out a couple of years ago may
I think it's Multnomah.
break down to that level, but
Well, you're saying both. If you just want the overall rates of poverty, like if I took all those 5 districts, and I'm sure that's on the ODE website, I just didn't put it here, so I'd have to go pull it out.
It'd be interesting to see, as we know we're serving nearly 18,000 children through the levy, and we know that a majority of them are living in poverty. It'd just be interesting to see how many children we have that are living in poverty in our community.
Yeah, because it's looking. You can get to that with school district FRL rates. That would give you your best idea of if I looked at all the school districts at the city. The problem with the community-wide data, I think, in the census, I'm not sure that I can get a cross-index of, like, say, 0 to 18 with poverty. It just does overall poverty, I think, because it's family. You know what I'm saying? So I think probably your school district data would be the best choice, and I can get that and send it to you if you'd like.
Yeah.
See it. I'll borrow your pen.
yeah, of course. Oops, before I go to the next slide, is there any questions on this one? Okay, so in the next one, this is just across the levy again for the 18,000 children that we served. a breakdown of the subpopulations within the children that we served compared to school district enrollments. And again, with the lens of, at a minimum, we would want to be sure that we are proportionally serving at least the same sort of population as what we see in the school district, but more importantly, that we're reaching we are reaching populations at a proportionally greater amount that are at a higher risk of negative outcomes. So in general, this slide would tell us that we are reaching those subpopulations quite well in terms of how they're at risk for certain types of negative outcomes. And there are some groups where we're not quite on track with even what the proportion is of the population in the school district enrollment. For example, Asian and Pacific Islander children. One of the reasons that we may not be sort of on parity there is that we didn't receive any applications specifically for culturally specific programs or otherwise to serve that population. There are those populations are being served in many of our other programs, but we didn't necessarily get culturally specific programs that applied to serve those populations in our program areas. Another sort of important thing to note here is that for Native American Alaska Native children, according to the report that came out a few years ago from the Coalition of Communities of Color, there is likely a pretty significant undercounting of that population in our community based on a number of historical factors. And so when they went through and kind of did a community-validated approach to counting and determining what portion of the population they make up locally in Multnomah County, the rate that is asserted and backed up in that report is around 5%. So if that rate is true, and if the school district data undercounts that population for the same reasons that the coalition outlines, then perhaps we are underserving that population as a portion of what they make up in the school district as well as the community at large.
One addition to that is that one thing that is probably likely is that some folks who identify in part as Native American, as well as other groups, are in the multi-ethnic, or it should be multiracial/ethnic category. So that category, because it isn't further specified in our current forms, we don't know what's underneath it. So we just don't really know the answer there. But that's just something to keep in mind. Go ahead. Sorry.
No worries, thanks. Any questions on this one? All right, Lisa.
So as you've just seen through the slides that Meg's reviewed, overall, the levy has successfully directed proportionally more programming to populations that are disproportionately at risk of experiencing poor outcomes. So through this next set of slides, we'll examine by each program area how well investments are reaching vulnerable populations. So we'll start with early childhood. This slide, again, we're comparing the specific populations you'll see on the far left column and percentage of children served by early childhood programs for each of the populations as compared to the number of children in the school districts. So for an example, the first line you'll see African American and African children represent 15.5% of the children served in early childhood programs as compared to 10.2% in the school district. And on down the list, you'll see the comparisons. The key point really with this data is that EC programming, or the early childhood programming, is reaching some of the vulnerable populations that we intend to reach and not reaching some of the others that could benefit from extra school readiness support. Again, just the reminder, as was mentioned before, with the Native American population actually probably more towards 5%, we'd be proportionally underserving in the early childhood area. While these data have stayed pretty much, did you have a question?
Okay, you had a question.
I do. I'm looking at the heading, percent of
that's-
levy early after-school participants.
Right.
Oh, okay, I see. It's correct on here.
It's corrected on this. We saw
Thank
that
you.
error
All
just,
right.
I know,
Okay.
we saw that error just as we came in.
It's different on here.
Yes,
That's
it
good.
is.
Okay, thank
Purely
you.
a
You're right.
typo, and that it was
We
somehow
need to
missed
do
in the-
editing our materials.
All right, thank you.
So in the early childhood area, these data have remained pretty consistent over the past 3 years. and really bring this up to point out that we may want to focus future investments on vulnerable populations, specifically Native American, Alaska Native populations, but at the same time not losing the ground that we have with the Latino and African American populations, because we know that all three of those groups are at risk for experiencing negative academic outcomes. Let's see. Any other notes in early childhood?
Nope.
Okay, next we'll move on to two program areas, foster care and child abuse, and combining these two areas because instead of comparing to school district data, we'll be comparing to child welfare data, number of or percent of children in foster care. And so again, reading the chart in the same way, looking at African American and African children served by the foster care programs, 26.4%. If you move to, as compared to 22.1% in foster care, which seems fairly good proportion. But when you compare that to the child abuse prevention and intervention percentages with only 13.2% of the children being African American and African, it raises issues of what can we do in terms of setting policies and priorities around prevention and intervention efforts to help keep children, African American children who are overrepresented in the foster care system out of the system in the first place. In terms of the foster care data, the key takeaway with this really is that our priority setting that we did around serving children, African American and Native American children through foster care programming and having culturally specific programs set up to serve those populations has yielded positive numbers here where we're actually serving proportionally more in the foster care programs than are actually represented in foster care. In the child abuse area, or one other thing in the foster care area is that over the past 3 years, the percentage of children, Latino and Hispanic children in foster care has actually risen each year over the past 3 years. And you'll see with our percentage, we've been served, through our programs, we've been serving 6.6% Latino and Hispanic children as compared to 14.3% in the foster care system. And so that's another area to consider possible focus for future investments in foster care, specifically for that population of children. Let's see, and I mentioned with child abuse the two primary areas of concern in prevention focus. Let's see, so next we move to the after-school area. And again, this chart is set up in the same way as early childhood, where we're again comparing the numbers served, this time actually really by the after-school programs to the school district enrollments. And the key point in this, which has been true over the years, has been that the after-school programming has successfully been directed to the populations most at risk of the achievement gap. Let's see. And again, the same issue, this reminder about the Native American population being, if it's more likely to be 5%, then we're slightly under proportion in the services through our after-school programming. Other notes on after-school? No. The least level of concern there, I'd say. And then the final chart here compares mentoring, the percentages served through the mentoring programs, again, to school district enrollments. The key point in the, did we do it again?
Yeah, it's my fault. I was the one.
The key point of this table is that the mentoring investments are reaching some of the populations likely to experience negative outcomes, but not reaching all the populations that could benefit from mentoring services and supports. You'll see, if you look, for example, again, the Native American, Alaska Native, again, if it's 5% more realistic and we're serving 1%, Latino population as well. And one of the things to point out in this area that there is some tension between the proven best practice mentoring guidelines and some of the approaches and what works best in some cultural communities. And we found that some of the newly immigrated cultures, communities, are not as receptive or don't really understand the mentoring approach that is outlined in the best practices, as well as Native American culture as well has a different kind of approach to mentoring than what is in the best practice guidelines.
It may or may not be in other words, we didn't also receive a lot of applications, I would say, as well, for culture-specific mentoring programs. And then the one that we funded in the last round, we chose to stop funding it in this round because it was very difficult to reach the populations to get them to participate, which is, not necessarily, there's many variables in there, so you don't know what all the answers are. But that may be some of the reason it may not be the most appropriate intervention as it is delivered in its best practiced format for certain cultural groups. There just may be other interventions that are better. So it's hard to know what to make of the numbers sometimes given those variables. So it's something to keep in mind either way. Did you have a question? No? Okay. I saw an eyebrow go up. So I'll do the last slide just to kind of say what don't we have here, even though you might feel like you're drowning in things that we do have and would prefer we have less. There's a few things that are masked or just don't show up in this data that are worth noting, and these are questions that we get in the data world that maybe don't rise up to your level. But one of the things is that by using either white or Caucasian as a category in which to put people in, as well as using black as a category in which people assign somebody to, and that's the case for school district data and DHS data and other, everybody's got their own definitions. You can mask certain subpopulations, and that's just something to keep in mind because we don't have a separate designation on our form for newly immigrated Caucasian immigrants, many of whom are from Eastern Europe, and who suffer certain kinds of barricades or barriers to succeeding in our society and may have higher risk factors for poor outcomes that we care about. But we're not clear, we don't know whether we're reaching them or not because they're masked in the population numbers that we have. And the same goes for African immigrants, which are not typically separated in most of the data places. And many of our grantees do separate these populations out for us, but because we don't mandate that everybody does it, we don't have consistent data for every grantee, and we don't have good comparison data because at the school district level, those are not decoupled. So African immigrants and African Americans are in the same category, and they may have there may be very different kinds of risks in dealing with those populations. So it's just something to keep in mind in terms of trying to assess how good we're doing or what a good job we're doing or not doing with certain populations. We don't really know with, I would say, African immigrants and immigrants from Eastern Europe, particularly, whether we're doing a good job of reaching those subpopulations or not, because our data doesn't really reveal it. The second is that we've received requests from various folks in the community to change the way that we do our demographics. And I think we are going to take this under consideration for the next round of the levy, is to probably do two different, which is, I think, based on what I've been able to understand about the census data, it looks pretty similar. You have what's called sort of unduplicated data as well as duplicated data. So you look for all the folks who classify as one race predominantly, those are counted one time, and then people who don't classify as one race predominantly are two or more races. That's a kind of our multiracial or multi-ethnic category that we use in our forms. And that's the count that's the only count we are currently reporting to you, okay, is that unduplicated count. The census also then looks at a duplicated count. It's looking at, for people who identify as more than one race or ethnicity, it allows them to put that in, essentially, what are the different categories, however many there might be, and then it also adds up in various subcategories how many people are, say, identifying as a combination of Native American, African American, and white, or some other set of combination of racial characteristics. So you can look at subpopulations of people, and you can understand also all the different ways in which an individual might be categorizing themselves. Now, when you do that, you end up with more. So if you want to count it as a duplicated count, if we say we serve 17,000 children, but I might be in this duplicated count talking about 25,000 children potentially, or 25,000 different identifications with different groups, if that makes sense. That's what a duplicated count looks like. So I think we're going to sort of form a group to figure out how we should do this and what the capability of individual programs is to do this, to be able to present the count in two different ways. So you can see both an unduplicated count for everybody who identifies significantly as one, as well as a duplicated count that looks at the variation in the multi-ethnic category. And it should help us understand a little better. So one of those tensions you can pick up from those slides is we can see that if the Native American population is somewhere around 5%, based on the coalition's report, we're only serving anywhere between 1% and 3% in any given program area of that population. But we know that the multiracial category is likely contains at least some Native American or Native Alaskan children. So this might illuminate how much we're reaching in different categories to try to get a better understanding of that as we go forward. So that's kind of where we're heading. The county is, at least the Department of Human Services at the county, is looking at moving to this method as well. So we'll kind of consult with them as well as consult with the broader community on how we might do that.
I have a question about that in regards to the Native American and Alaska Natives. If the common thinking is that the school districts are not counting correctly, how do we know that our data is counting correctly? Or when you say that we could be, off in the numbers that we're serving, or we could be on if we're miscounting it as they are miscounting?
Well, what we're doing is, I would say our numbers are fairly consistent with the school district, and that is the best I can gather is that there is a group of folks out there who do identify predominantly as Native American and check that box on forms. And what the Coalition Communities of Color report says is there are many people who don't check that box or check a box that is, they check many things.
And I get that. I get how having the unduplicated and the duplicated comparisons could be helpful in finding that out. But when you say that, back on the prior slides, that our numbers are really off compared to if the school district.
Well, we don't know how much. We
Yeah.
don't know.
That's what I'm trying to say. We don't know because, never mind.
No, I think I get it. You're saying we can't be any more confident in our numbers than the school district is.
Thank you.
Yeah.
Right, exactly, that's exactly what the coalition's report is saying, and the same for the census. And so if we're looking at the census numbers, I think the coalition would say the same thing about all of those reports. They are all equally unreliable, and what we're really looking at is, so what we're trying to compare to is both the official things that are out there, which we know are undercounted, as well as what the best estimate we have locally is, which is about 5%. So we're trying to look at two different standards, I guess is the best way to try to rectify that situation. Does that make sense?
Thank you.
Did you? No? Okay. Julie? No? Okay. So that's something that we'll move toward if we are renewed, to think about how we can better capture that information. The last is, I would say, we get a request from time to time from grantees and from other folks to do what's called disaggregating data across outcomes. So that would be to say, right now the school district could tell you whether what the percentage of African American youth is who meet the third grade reading benchmark, and they can tell you what the percentage of white children are who are meeting the third grade benchmark, because they can take their outcome data and disaggregate it by race because they have individual data on each child in the school system. We don't currently collect our data that way, and in order to do that, we would have to have a database into which grantees would enter, or we would enter, somebody would enter, individual demographic information on each child in order to be able to take different variables and marry them together like that. What happened to an outcome versus somebody's status as either poor or of a certain race or otherwise, some other variable. It's unlikely, although there's a lot of value to doing that clearly, it's quite a big step in terms of the amount of work it requires and the expense it would take to create a database that way, as well as the fact that it would duplicate work for many people because people already have to enter this sort of information into many databases, including the school database. So we are not probably moving in that direction ourselves just for the time and expense it would take. If there's any way for us to tag into there are movements afoot to improve the data collection community-wide, and Cradle to Career certainly is looking at this. The Hub Network is looking at this, so there may be some movement out there there may be ways for us to piggyback into. That's probably the best we're going to get in the near term, given the financial constraints that we're currently operating under. But that is something that is often brought up, and so I felt we should address why we don't do it at the moment and what the prospects are for the future. So I'm hopeful that as a community we'll get better at this, but at the moment the capability is not there. So that's it for part one.
Okay. Well, thank you. Appreciate your time and effort to synthesize all this data. And I also want to thank, once again, all of our grantees and Levy friends who attended our December 5th City Council meeting, where we voted to place the renewal of the Children's Levy on the May 21st, 2013 ballot. Currently, we have no allocation committee meetings scheduled for this time, but we will have.
February. We're waiting. The revenue forecast comes in January, so we'll be looking to schedule you all for February. I just was trying to get a date from
February of
Josh.
2013. So to my colleagues on the allocation committee, happy holidays. To the staff and everybody else, happy holidays. We stand adjourned.
Thank you all.
Thank you.
Thanks.